Imagine you own a restaurant. You're given one big lump sum of money. And that's what's going to help you run it, all your costs. So there's two scenarios. Are you going to be happier serving a modest number of customers reasonably well, or would you prefer to serve an increasing number of customers with the highest quality and the latest innovation? Pause for a moment to think about that. You've already got that lump sum of money. You're not getting more money. That's how much you have to run your restaurant. Turns out, human nature says, you're going to be just fine doing kind of the bare minimum. Reasonable quality. Don't overexert yourself. Because that'll keep people mostly happy, and you won't have to work crazy hard. That's what we have in our healthcare system today. That, ladies and gentlemen, is block-based funding, and it is holding us back. It is preventing us from getting the innovation, the service numbers, decreasing the wait lists that we want as a society out of our universal healthcare. Because everybody says, oh, Canada, you've got universal healthcare. Yeah, except we don't, because people don't get what they need in a timely fashion. And that, to me, is not universal healthcare. If you said, Jim, would you like to go to the bakery and get 2 loaves of bread and a dozen cinnamon buns? Oh, but I meant 9 months from now. I'd be like, I'm hungry today. 9 months doesn't cut it. And yet, we let this kind of thing just linger and we say, well, what can we do? Well, here, ladies and gentlemen, is one simple switch. The healthcare edition. One simple switch. Let's get rid of that block-based funding and let's put in patient-focused funding. So in that kind of a system, the way that a hospital gets what it needs is dollars track the patient. When a patient gets served, when a patient gets processed, when a patient receives care, then the institution gets funding. And of course, they need some funding because there have been resources, person hours, equipment, infrastructure that have gone into serving that patient. So there has to be funding. But if it is attached to the patient, then the system continues to be motivated to serve more patients with quality, because you want people to come back, with a high desire for excellent outcomes, and with an ongoing incentive to innovate so that people get the best and highest quality care, and that we continue to look for ways to be able to do it more efficiently, more effectively, or just playing with newer technology that is better for everyone. Patient-focused funding. Already do it in Southeast Asia, in countries like South Korea and Japan. Already do it in Australia. Already do it in many countries in Europe. There are small shell programs in North America that do it also, but we need it across our system. We spend a lot of money. Every time you hear an argument that people say, oh, we don't have enough resources, we need the government to give more resources. No, we are in the top quartile, the top 25% of countries worldwide in terms of what we spend on healthcare. But we are in the bottom quartile, the lowest 25% in terms of outcomes. Outcomes in terms of like surgical wait lists, access to radiology imaging, overall provision of services. We do it very poorly. And don't give me that, oh, it's about the geography thing. Yeah, we got geography. We're always going to have that as a thing that we got to grapple with in Canada. But we 100% don't have a culture of innovation. We don't have a culture of increasing efficiency. And it's in this switch from block-based funding to patient-focused funding that we can capture that. Here's a practical example. You probably know someone who has either had or needs cataract surgery. It's well known that there are 1-year-long waiting lists for cataract surgery in this country. And an average surgeon can do, by the way the system allots it right now, 18 to 20 cataract surgeries a day. But if you have a motivated team who's working as a highly efficient unit, who is looking for innovative ways to provide care and is willing to flex and multitask and do different things, not just say stuck in roles and not just say that's not my job, could easily get 30 cataract surgeries done in the same amount of time as our system allows 20. But who's motivated? Well, here, this person, they're already collecting a salary. They're not motivated to work faster or more efficiently. And the system writ large doesn't have any of that because they just get a block based of funding to run their operating room from the Provincial Ministry of Health. Bottom line, we don't have a working Canada Health Act if we don't have patient-focused funding and timely access to care. And who doesn't want to celebrate that they've got renewed vision, or they've got a new hip, or they've got that hernia fix they've already needed? Well, I've got a restaurant we could celebrate at.